recording. There we go. Right. Thank you, Michelle. Do you want to introduce yourself and what you're going to tell us a little bit about today?
Hi there. Yeah, my name is Michelle Broughton, and I'm the team manager for the Learning Disabilities and Autism Key Worker Programme. We work alongside the Dynamic Support Register, and I'm here to tell you about the Key Worker Programme.
Brilliant. Thank you. Right. Go for it.
So what I'm gonna try and do is answer some of the questions that have been sort of like coming in terms of wanting to know who we are, what we're about, and how we support. So hopefully by the time I've finished, you will have all of the answers that you need to your questions. So what the first question that has come in is, what is the Key Worker Programme? So the Key Worker Programme is a service that has been developed as a response to the NHS long-term commitment that by 2023-2024, children and young people who are autistic, have a learning disabilities or both, and aged up to and including 25 and are on the dynamic support register will have a designated key worker. Now, it is an inclusive service and it's committed to the inclusion of children and young people with protected characteristics, for example, LGBTQ plus and mental health. Key workers will work closely with children and young people with a learning disability, who are autistic children and young people, autistic children and young people who have a learning disability. So the aim of the key worker is to ensure that children and young people and their families voices are heard, respected, and represented by building relationships and empowering them to problem solve. So they have consistency within the right support, the right services, and to be able to receive that all at the right time. The key workers will not replace any of the professionals currently working with the children and young people, but they will work within partnership with them and with the children and young people and their family to ensure that decision making is made with all in mind. So to make sure that they all have a part of that decision making within those services. So the next question was, how can families in crisis access a key worker? And currently families can only access us through we're being on the dynamic support register, and the only way at the moment that we're able to be able to get you onto the dynamic support register is through the professionals referral route. Now they are completed through professionals such as CAMS or GPs. We are looking to change the way that the referrals are made as of September, because of the dynamic support register policies have slightly changed. So all our referrals come through the DSRs, which is dynamic support register. These are local records of autistic people and or people with learning disabilities who are currently inpatients, who have a learning disability or in a mental health hospital, who have been identified at risk of admission due to their mental health or distressed behaviours. So we are currently working with those who are RAG rated, red and blues, and also ambers. But our current risk is those who are red, because we're trying to support those predominantly to come to reduce the risk of being admitted into hospital. So the DSRs are used to support people and help them to live safely, enjoying a good quality of life in their local communities wherever possible. So it's been able to pull together all of those services in order to support wherever they can, again, to reduce the risk of those young people being admitted into hospital. So people on the dynamic support register should be offered a review of their care and treatment. So adults up to 18, including 25, have a care and treatment review called CTRs. So the children and young people who 0 to 18 have care education treatment reviews called CETRs, and this can result to recommendations to the key worker programme if they feel that it's appropriate and necessary at the time. So again, if anybody wants any further information about the dynamic support register, they can always contact us directly or to contact the dynamic support register team. So what support does the key worker offer? So a key worker is someone who will work closely with an allocated child and young person and their family. They will take the time to get to know the child and young person and understand both their needs and their family needs. They will support the children and young people in achieving their aspirations and full potential with the aim of improving the quality of life through supporting their LDA needs. Now, what we will be looking to do is, so we can advocating for and with children and young people and their family to ensure that their voices are heard, understood and respected, ensuring children and young people have the right support from the right services at the right time, supporting services to work with the children and young person in the joined up way. We are there in order to represent the children and young people when they may not feel confident or able to speak up for themselves. So we also help the children and young people to work and have access to healthcare, education and voluntary organisations. We support by working with the children and young people to ensure they understand the importance of attending their annual health checks and are able to do so if that's what they choose to do. So we are here to be able to help children and young people with the transition into adulthood and into adult services. We enable more navigating through services to ensure all suggestions from the CETR are actioned to the best of what people can achieve. To ensure that all plans and are personalised, so it's young people focused and is created collaboratively with the young people to reflect their LDA needs. So we work collaboratively with professionals to ensure they are working with the children and young people in an appropriate way to support their LDA needs. And this is adapted through different ways in terms of such as easy read or visual aids or sort of social stories. So we're able to support professionals understand the best way in order to communicate with our young people. Participating in network meetings. So we work collaboratively with the children, young people and carers and professionals to ensure all current LDA needs are reflected. We work to ensure that all children and young people have an active part within their decision making, so making sure their voices are heard and that what they are saying they need and what they are saying how they feel is shared within professionals and with the rest of the teams that are working within that young person's care. Support networks to understand how to respond to children and young people who are with learning disabilities and or who are autistic, and upskill them to ensure that they have consistency to work with them and to ensure that message is getting across clear to that young person. Supporting children, young people and families by signposting to services that are available to them within the community in order to try and build that real solid structure around them, again, in order to prevent with hospital admission. Signposting children, young people and families to statutory services for ongoing support. So it could be that if we have got a young person who is currently working with a key worker and then we step down, that support still continues in the sense that they are signposted in the right way, that they reflect back on their current plans, that they are aware of what services to go to for advice. We've also had another question come in saying, how long does the intervention last? Now, this is time limited in intervention, and it can be anywhere between 12 weeks for a short-term intervention or 6 months for a longer intervention. Anything exceeding these require review to establish the reason for extended in terms of the intervention. So if we've got a young person who is in distress or the professionals are still trying to work out what fits for that young person, and it could well be that the professionals need to work together for a lot longer, or the actual support and intervention for that young person and the family is required for slightly longer. So we've got what areas does the key worker programme cover? So we actually cover Hampshire, Isle of Wight, Southampton and Portsmouth. So we work across all of the localities, and we work alongside the Hampshire Dynamic Support Register, the Isle of Wight Dynamic Support Register, Southampton Dynamic Support Register and the Portsmouth Dynamic Support Register. So each locality have their own separate Dynamic Support Register, but we come together to be able to discuss those young people who are actually sat on those registers who need that ongoing support. The last question is, will key workers work with other service providers? Yes, we will. So the main services we'll access through the local authorities, education and health. We work with professionals and support collaborative working across multidisciplinary teams. We also work with advocacy and commission services such as PBS4. mind, sensibility and respite services and local organisations in order for that carer package around that young person is tight, and that we're able to do what we can and explore a little bit more in terms of what services are required. So yeah, so that's what we do.
That's brilliant. That's really helpful. Thank you. I've learned a lot actually. Um, yeah, that was really, really clear, really useful. Can I ask, so currently you only support families who have young people who are inpatients. Is that looking to expand to sort of those families at any point that are at risk? Are you kind of, I'm trying to work out exactly where our families might be and sort of when they
Yes.
might expect to access support.
Yeah, so the support that we are offering is to avoid that hospital admission. That's our key
Right.
focus. So
Okay.
we're hoping to reach, which is where we tend to sort of focus more around those who are RAG rated red,
Yeah.
because the prevention of that hospital admission, we need to get in there early. So we also work with those who are inpatient in order to support that discharge planning. So in
Yeah.
order to get them back into the community, implement some strategies and some tools and put a package of care around those young people in order again to prevent that readmission into hospital. We then work with the AMBERs. So the AMBERs predominantly sit with those who may appear to be in a heightened state sometimes. It may be that they are at risk some weeks. It may be that there's a network surrounding that young person and the network are working really well. It's just sometimes if we've got a young person who is autistic with a learning disability or both, then we're able to come in and put in those strategies that appear to be missed from previous services because we are learning disabilities and autism. So
Yeah.
with that additional support that we're able to offer them, we're hoping that it will be much more lock, stock and barreled, that the support in the community would be enough. And then we also work with Greens, and Greens are those who are just sort of ticking over, who tend to bubble every now and again, but just to reassure them that the services are available to them. They have got that support still in the community. They just need to know and be aware of when they need to go and access that support or how they can access that support. And advocacy seems to be quite a big part of what we do. So we tend to sort of share with professionals and networks and community-based services. Actually, we've got a young person here who would really like to engage with your service but actually doesn't know how to. So that comes down to their sort of communication, their lack of ability to be able to fully process what that service does, how they can support, what they're about, and we can adapt that in order to support that young person understand what that service is about in a much greater depth, in hope that they would actually access that service once we've stepped away.
That's really good. That's brilliant. So we, as Reminds, make referrals to the DSR, the Dynamic Support Register for families. So if a family knows that they're on the Dynamic Support Register and they're kind of at that, upper end of it, can they then expect to sort of, if can they ask CAMS then about you and whether or not they're going to make a referral to you? Would that be sort of something families are
Yeah,
able to
so
do?
so what the main thing that we would be looking for in terms of receiving that consent form from the dynamic support register is if that young person is predominantly at risk of being admitted into hospital,
Yeah.
into a psychiatric ward, and that could be through a whole number of reasons, whether it's because of their mental health or they're displaying extreme challenging behaviours that puts themselves and others at risk. But they have to have a diagnosis of either autism or a learning disability to be able to access the dynamic support
Yeah.
register. And there are criteria that they need to be able to meet in order to be added to that register. So it's, although it seems, oh, there's that support out there and that sounds wonderful and it's great, but actually just the same as any other service, unfortunately there are criteria that we have to be able to meet. But predominantly we are working quite closely with CAM services anyway, because what we don't want is obviously people just coming onto the dynamic support register if there are networks around them who are able to support with that sort of when they reach crisis point or hit a situation where they're completely out of their own depth and don't know where to turn, that CAMS will be able to provide that support anyway. So It depends. It just
Yeah,
depends on what the situations are for the young people. But again, we never say never. If services and families feel that that's what the young person needs, or even the young person feels that's what they need, then all we can do is send in a consent form, and then the DSR team will take it from there.
brilliant. Okay. I think I can't think of anything else that I've been asked to ask you, so I'm going to stop recording now.